Hi everyone, I am Dr. Maheshwari, fertility consultant from Oasis Fertility, Ananagar, Chennai. Now we just touch upon what is uterine fibroids. Uterine fibroids is a small benign outgrowth in the uterine musculature. It could be of various forms. Based on the location, we can differentiate into the intramural fibroids, submucosal fibroids and subserosal fibroids. Intramural is the one within the substance of the uterus, and subserosal is in the outer layer of the uterus, and submucosal fibroids is the inner lining of the uterus where it will be present in the cavity. Of the three, the submucosal fibroids can affect your fertility. Now we just see what are the symptoms of these fibroids and whether the fibroids can affect your fertility. Okay. So of all the three fibroids, these submucosal fibroids can present with heavy menstrual bleeding or irregular menstrual bleeding pattern they may have. And one more thing, the fibroids, can it affect the fertility? This is a common question. This depends on the size of the fibroids as well as the position of the fibroids. Okay. If the size of the fibroids is like less than 5 centimeters and it is in an intramural or else in the subserosal form, it definitely always doesn't need surgery. But in case of submucosal fibroid, definitely you have to proceed with surgery because it affects the implantation. And we should know how that fibroid can affect the fertility. So fibroid can affect the fertility by means of reducing the implantation, by means of the tubal anatomical disturbance it can make, or else it can form a difficulty in the sperm ascending manner. So these are all the ways by which fibroids can cause infertility. And one more question is like, do I have to need the removal of fibroid before proceeding with the embryo transfer? This, as I discussed before, we have to look upon the size of the fibroids, position of the fibroids, and also the presence of multiple fibroids. These are all we have to take into account. In case of submucosal fibroids, better you go ahead with the fibroid removal before going ahead with embryo transfer. And in case of submucosal and subserosal fibroids and previous no embryo transfer failures and all, and if the size is less than 5 centimeter, we can go ahead with embryo transfer. Thank you.